Hello, Dr. Thomas and my fellow colleagues. My name is Jennifer Champon. I'm a student nurse practitioner at United States University. This week's case study is a male patient who I had encountered with. Is African American male, came to the clinic unaccompanied, but very reliable historian. Came to the clinic complaint of a cough that won't seem to go away, feeling feverish, fatigue, and difficulty of breathing. So the history of the present illness is that he been having a clear to thick, yellowish, productive cough, which caused him very fatigue and shortness of breath. The patient reported taking over-the-counter medications, but has no relief whatsoever for the past days. The cough is getting worse with during activities and finding it very difficult to sleep at night. He does reported chest discomfort with the consistency cough and been taking a Tylenol for a discomfort of a level of pain which is 4 out of 10. And the pain does not relate to any part of the body. So his past medical history, he has a chronic lower back pain, hypertension, and high cholesterol. Having been said, he also has no history of hospitalization or any surgeries, and he is not allergic to food or drug or any environmental problems. The only medication that he is being currently taking is the gabapentin for his lower back pain and milazicam for the pain, also lisinopril for blood pressure medicine, and atorvastatin also for his cholesterol. And Tylenol is just any discomfort or any pain that he does at home. All his immunization also is up to date. So based on the assessment that I came up with, or what the assessments that I did on the patient, his pain level was 4. The temperature was 101. The heart rate was normal sinus rhythm, which was 80%. His heart respiratory rate was 21, and he also was sitting 97% while in the room temperature. So during the physical assessment, all body parts were normal except the respiratory problem that he was experiencing. So listening to him, I heard the ronca breathing sounds, bilateral lower lobes upon oxytation, and then the productive cough that he was bringing out, which was yellowish sputum. And he also was experiencing shortness of breath. Based on the assessment and the differential diagnosis that I came up with, the final one was bacterial pneumonia, because it is the inflammation of the lungs, and most patients are experiencing cough, chest pain, yellowish sputum, and shortness of breath. So which all these symptoms, according to CDC 2020, shows that Mr. MJ was experiencing all these, which made me to finalize that my final diagnosis was bacterial pneumonia. The second respiratory issue, or the pulmonary diagnosis I came out with, was upper respiratory infection, whereby that is a common cold. So with the symptoms that Cash and the other team and the other authors 2021 relates to that the upper respiratory infection is caused on the respiratory tract, whereby the person will experience congestion, runny nose, cough, and a headache, which is not even part of Mr. MJ's symptoms that I experienced. The third was the bronchitis. The bronchitis also was ruled out because the airway and the cough, he didn't even have any low-grade fever, which was above of that, and then there was no reason also that I did her. So um, my final diagnosis was bacterial pneumonia. The diagnostic plan that I had for him was to get chest X-ray and also do a blood test to know the level of the CBC, able to fight or clear any infection, and also a blood culture and an sputum culture, just to rule out as many as it is. And when it comes to the treatment plan that I had for him, I ordered azithromycin, where the azithromycin, he would take the 2 tablets the first day, and then the single tablet on the next 4 days to complete the course of the treatment. And also, I prescribed mucinous or any cough medication that will help him to feel a relief of the cough with the persistency cough that he's experiencing. I also advise him to take any Tylenol 500 milligram tablet, able for any chest discomfort when he cough, and humidify his room to make sure like his airways and then the environment seem to be clear from germs. The education that I highly recommend for him is to complete the whole full course of the antibiotic that is given, even the symptoms get improved, and also to drink plenty of water and get some rest, as well as making sure that monitoring the signs and symptoms of the bacterial pneumonia. So as a follow-up, I advise them to come within 10 days to make sure that the infection is being cleared. If it's not, I highly recommend him to go to emergency room and then get a further treatment. Thank you for a short of my my case presentation. Have a good night. Bye-bye.